What if your clinic was designed by your patient, not by what looks modern, not by what impresses the owner walking in, but by what feels safe to your dog or survivable to a cat? Over the past decade, I shifted my focus from appearance to experience. What animals see, hear, smell, and fear inside our space. The question changed everything about how I practice. I am Dr. V. Manigandan and I am running Barking Pine Hospital in Chennai. What I am going to share today is not theory. It comes from over a decade of watching animals walk into spaces built for human and the way how they respond. Stressed, uncooperative, aggressive, or shut down. The moment I started asking what the animal was experiencing instead of what the clinic looked like, the outcomes changed. Most veterinary clinics are designed like human hospitals. Bright overhead lights, polished floors, open echoing rooms, constant movement. To a human, this signals hygiene and modern medicine. But for the pets, it signals something entirely different. Mostly animal processes spatial information as survival data. Every element of that environment is read through the lens of am I safe or am I in danger? Height triggers a danger response because in the wild, being elevated and exposed means vulnerability. Slippery surfaces eliminate an animal's ability to control its own body, which is one of the most destabilizing experiences a prey animal or a stress predator can have. Noise is processed as threat information. Bright, uncontrolled light means exposure with no place to retreat. They are not difficult patients. We are reacting to our design. And once you understand that, everything about how you build and manage a clinical space changes. The core insight that changed my clinic design is this. Dogs and cats do not just prefer different environments. They have fundamentally opposed survival instinct and spatial needs. A dog reads open visible space as safe because it can track movement and assess threat. A cat reads that exact same open space as dangerous because it has nowhere to hide. A unified clinic design fails both species simultaneously. The solution requires two separate architectural systems. One built around canine neurology, one built around feline neurology. Not as a luxury feature, but as a clinical necessity. Dogs are pack animals with a strong orienting instinct. In an open visible space, a dog can track who is moving, where they are going, and whether there is a threat. The predictability is common. If you remove it, dogs start to be more reactive and resist examination. The canine open hall system is built on three physical features: low height examination tables that eliminate the height danger trigger, leash guided restraint for controlling pet in a better way, and position based triads where the dog's location in the space itself communicates its clinical priority without the need for chaotic repositioning. Movement design is equally critical. We have two complete separate pathways in our clinic, one for the pet and for the public, another for the staff and the doctors. These paths do not cross unnecessarily. When a stressed animal does not have unpredictable human cutting across its paths, its arousal level drops immediately. Functional zoning takes this further. The clinic is divided into clean and dirty zones with no overlap. Samples move directly from the examination point to the lab through a defined route with no backtracking through the public or animal holding areas. The result is predictable movement, reduced cross-contamination risk, reduced stress, and significantly improved workflow efficiency. Cat needs the exact opposite environment. Where a dog is calmed by visibility and predictable movement, a cat is calmed by concealment and stillness. A cat's primary survival strategy is to hide, assess, and then act. When you remove the ability to hide, you do not get a cooperative patient. You get an animal in a full fear response. The feline private suite system is built around three non-negotiables. Strictly private rooms with zero visual exposure to the rest of the clinic. Minimal sound intrusions because a cat's auditory processing is significantly more sensitive than a dog's. An unexpected sound is processed as immediate threat, and built-in examination suites, which are recessed spaces within the room that allows the cat to be examined in a position where it feels partially enclosed and therefore practically safe. Strict movement control in the feline zone is not optional, but it is a must. Every unnecessary entry into that space, every door left open, every noise from an adjacent corridor resets the cat's stress level. The results of getting this right are measurable. Less aggression, significantly less need for sedation, and genuine cooperation during examination. Every surface, every light source, every sound in your clinic is communicating something to your patient. The question is whether you are controlling that communication or leaving it to chance. Light first. Dim and controlled lighting reduces the feeling of exposure in animals. Bright overhead, cool, white lighting, which is standard in most clinical spaces, creates high contrast environments that heightens alertness and arousal. Replacing or supplementing with diffused, lower intensity lighting in examination and holding areas directly reduces stress responses. The principle here is not silence versus music, it is chaos versus controlled sound. Absolute silence is unnatural and can itself create tension. What the auditory environment needs is consistency. Low volume, no sudden changes, no sharp high frequency tones. Clinically, music therapy for animals, when used correctly, can actively reduce cortisol levels and lower heart rate. The key words are used correctly: low volume, gradual transitions, species appropriate frequencies. Color and surface, brown and earth tones have a measurable calming effect in clinical animal environments, partly because they align with the natural visual palette animal associate with safe sheltered spaces. Non-slip surfaces are not a comfort feature. They are a clinical necessity. An animal that cannot grip the surface beneath it is an animal that has lost physical control, and loss of physical control triggers an immediate fear cascade. Grip restores confidence, confidence allows examination. Everything I have described so far might sound like a full architectural rebuild. It is not. You do not need a new clinic to start changing how animals experience your space. There are 3 interventions that cost very little and change a great deal. First, lower your interaction level. Consider replacing standard high-rise examination table with low-rise ones, which facilitate examination and reduces high danger trigger. The animal retains partial control and then the cooperation follows. Second, add non-slip surfaces. Mats or textured overlays placed over existing slippery floors immediately restore an animal's sense of physical control. This single change reduces struggling during examination, reduces the risk of injury to both animals and staff, and visibly lowers arousal within seconds of the animal stepping onto the surface. Third, control movement and sound around your patient holding zones. Restrict unnecessary staff movement through or near areas where animals are waiting or recovering. Actively manage ambient sound. Turn off non-essential equipment noise, lower voices, remove sharp auditory triggers from the immediate environment. These are behavioral changes, non-structural ones, and they can be implemented today. We spend years learning medicine, surgery, pharmacology, and diagnostics. Very little of the training ever addresses how animals experience the space in which we practice. But when we change that, the outcome changes. Staff safety improves because animals are less reactive. Examination becomes faster because patient cooperates. Clinical decision becomes more accurate because the animal is not in a stress-induced physiological state. Designing for animal comfort is not a soft consideration. It is a clinical one. Environmental stress directly elevates cortisol and adrenaline, alters heart rate, and respiratory rate and compromises immune function. An animal examined under high stress is not giving you clean clinical data. Reducing that stress through design is as much a part of accurate diagnosis as the examination itself. So the next time you look at your clinic, do not ask how does this look, ask how does this feel to them. The best designed clinic is not the one that impresses humans. It is the one animals do not fear.